the world of breast cancer. It's horrible that it's so pandemic. It galls me that we're not doing more to look for the origins and modify the risk factors. It's a toxic world. There are things that can be done. We just don't have the real focus on the prevention. It's sad but true. There's not a lot of financial interest in keeping people healthy. Well, one of the things that I value the most in my relationship with patients is giving them the freedom to make choices, giving them information so that they can make rational decisions that suit their life, that suits your life, your philosophy. Somehow, in medicine, we have developed this sort of paternalistic attitude that we know what you need and what you need to do, and we're going to tell you that. Very few places is this more prevalent than in the mammography demand. I'll call it demand because it is really quite uncommon to have a doctor literally reflect on risks and benefits and contemplate whether or not this is the best path forward. The conversations, as I've heard them expressed to me from patients and as I've seen them manifested, is more like, you have to get your mammogram. It's not a law. You don't have to get it. Maybe recommended by some. But what's the evidence say? And is it the same for everybody? You have to get your mammogram. Why? Why is it a must-do when, in fact, in other countries, it's not even recommended? We have to really take a step back. When we're commanded to do something, it drives skepticism. What's behind it, right? I can remember when, now they may not still be doing this, but when I was in the insurance-based conventional medical world, bonuses were given based upon practice excellence. One of the metrics of excellence was what percentage of women in your practice receive mammograms. Well, you can imagine what it did. It drove doctors to command the mammogram, standard of care. The standard of care is opaque. Like one group says you should start at age 40, another at age 50. One group says every year, another says every other year. Well, here's some data points that hopefully you guys can use as you have this conversation with your doc. The real reason why we would do any kind of a screening test is to prevent death or negative consequence from the disease that we're screening for. Hey, skin cancer screening, that makes sense. It's easy to see. Now, with regard to mammogram, there was a large study, it was out of Canada, looking at some 80,000 women. Half the cohort had mammograms, the other half did nothing. That is, they didn't do mammograms. What they found was that the women who had mammograms, in fact, they could identify cancer a little bit earlier. What they also found, however, it didn't make a difference. The death rate was the same, even if the cancer was discovered a little bit later. Now, studies are not ultimately definitive, but by virtue of not getting the mammogram, those women were spared irradiation to the breast, right? Ionizing radiation is a carcinogen. Mammograms are a carcinogen, albeit the dose is relatively small, but it's a cumulative carcinogen. The earlier you start, the more often you get them, the more damage can be done. All right, so there's a concern. The other concern is chasing shadows, false positives. You see a shadow. Now we're in that dilemma, classic for medicine. You do a study, you see a lump. Could be benign, but who knows? All the pressure and all the financial incentives are pushing for the biopsy. You do a needle biopsy, everybody gets paid, and there's a bit of insulation from a malpractice suit in the event cancer becomes present. Well, the same thing can be said for the mammogram. If you choose not to get a mammogram, you have to then have a documented patient declines mammogram. That's totally cool as long as the docs are reasonable about it. They shouldn't make you feel like you're committing a mortal sin. It's your choice. And the evidence supports the decision. I believe this to be very contingent upon the risk-benefit analysis. A big study was done in China. They compared mammogram to ultrasound. What they discovered was that the ultrasound was better, more sensitive, fewer false positives. Oh, by the way, it doesn't hurt, and there's no radiation. So why are we still X-raying breast tissue, right? Think about what happens in the event that breast tissue comes in and it's dense, or they find another anomaly. Oftentimes, they do an ultrasound afterward, implying that the ultrasound is a superior test. Well, why not do that in the first place? So I wondered about that, and I did some research, and what I discovered was the primary reason why we do mammograms to screen for breast cancer is because we discovered X-rays first. When X-rays were discovered, they started applying it to breast tissue. They developed a comfort level with looking at the shadows. They developed a protocol of analyzing them. Then they developed a multi-billion-dollar business surrounding mammograms. A breast health center sprang up all over the country. Well, are you going to tell them tomorrow that, we're not doing mammograms anymore? Now we're doing ultrasounds. Yikes. You've just disrupted a colossal industry. There were studies done out of Europe where they concluded that mammograms caused harm, and in many cases advised against them. Now, how could they cause harm? False positive. You see a shadow. You stick a needle in it. You do a biopsy. Now you've created scar tissue. You've created disruption to the anatomy that are going to make all future mammograms more difficult to interpret. I've seen women come into my practice that have had umpteen mammograms with biopsies, multiple biopsies, needle biopsies, chasing shadows. Just slow down. There are better ways to approach it. And the most important variable is the individual. What do you want to do? How are you going to sleep at night? What's your comfort level? I think this is absolutely absurd when they came out with a recommendation that women should stop doing self-breast exams. Just stop it. After all, you moron, you don't know what you're doing, and you're more likely to be confused. This is insulting. Many women have found breast cancer through their own self-exam. Oftentimes, a mammogram is normal and a lump is found through palpation. There's absolutely no downside to doing a self-breast exam, ladies. You don't have to have a medical degree. Don't do it too often. I recommend it once a month. If you do it every day, you can't perceive a change, right? It's like watching grass grow. You do it once a month in a methodical fashion. And yeah, the breast tissue can be kind of lumpy in general, but you're looking for that queen marble in the sand, something that stands out. Now, what are my thoughts about who should get a mammogram or who should consider imaging? First, I universally prefer ultrasound. The problem is insurance companies often will not pay for an ultrasound unless a mammogram is done first. That's just dumb. You can certainly request of your doctor that they order the ultrasound, and in some cases, just pay for it. If you have the means, it's not that expensive, and it spares you the misery of the mammogram. How about doing thermography? Never. It's a waste of your money. Now, I get it. It's not a mammogram, and there's no radiation. Here's the problem. If a thermogram is negative, it doesn't rule cancer out. And if it's positive, if they see a hot spot, guess what? They're going to recommend a mammogram. So you have the same sort of dilemma. It's not a useful test. Self-breast exam I like. Now let's break it down a little more. What are the risk factors? A grandparent with breast cancer does not significantly increase a woman's risk. A first-degree relative, a parent or a sister, has a slight notch upward. Certainly, if you have a BRCA gene mutation, that changes things a bit. But the vast majority of women who get breast cancer have no family history. It's like over 90%. So the family history neither damns you to a horrible fate, nor does it protect you significantly. If you are a large woman, well endowed, with a lot of breast tissue, the imaging, either ultrasound or mammogram, has more value. Is a lot of tissue for a lump to hide in, it's harder to determine it. I see women with like A cup, B cup, some with a C cup, lean, petite woman, barely breast tissue to worry about, easy to examine. The mammogram is not going to really have the same value to them as it would to a woman who may be 250 pounds with D cup or more. This is relevant. We should risk assess. We shouldn't just carpet bomb and make the same recommendation for everybody. If you've had a breast implant, I do not advise mammograms for several reasons. One, potential damage to the implant. Two, you've got a wonderful platform upon which to do your self-breast exam. And the reason an implant was done often is because of relatively modest breast tissue in the first place. An ultrasound is reasonable. An MRI, I consider that a bit of overkill. Problem with an MRI is you're going to see things that aren't worth seeing, that create the same treadmill of contemplative worry with a potential needle biopsy somewhere in your future. Ultimately, there is no dogmatic answer. And that's the message I want to leave you guys with, or provide to you, that it should be a contemplative decision. And if you choose not to get a mammogram, you're not recklessly damning yourself to a horrible fate. You, and only you, have to be comfortable with every decision you make. If you choose not to get a mammogram doing your self-breast exam and cancer is discovered, you've got to be comfortable with the path you walked. The research would support that you didn't do anything to pull the roof on your head. Here's what makes ultimate sense for everybody. Reducing the risk factor for cancer. Mammograms, remember folk, they don't prevent cancer at all. As mentioned, they impose a carcinogenic ionizing radiation onto a cancer-prone organ or tissue. Now, what matters? Percent body fat. You must aspire to control your percent body fat. In some cases, it requires medical support. In every case, it focuses on nutritional modification. A topic for another day, but you cannot exercise fat off your body to a significant degree. You must focus on carbohydrate consumption. All right, so percent body fat. What else? Okay, cigarette smoking goes without saying, but by golly, I just said it. What else? Physical activity? Yeah, that's a good thing. How about toxic carcinogenic metals? Cadmium in particular has been correlated with increased breast cancer risk. And guess what, folks? You got it in your body. It's there. At Intellectual Medicine, we can do the provocative test that pulls it out of the tissue where it's hiding. You can't test cadmium in your blood. It doesn't stay there. It goes into the tissue where it hides and it builds and it oozes cancer risk. By virtue of provocative testing, we can determine if cadmium's there and roughly how much. And then we can guide you towards a way to reduce it. DMSA, dimethylcaptylsuccinic acid, a prescription capsule that we can prescribe, inexpensive and effective. Another way to get rid of toxic metals, saunas. You could sweat it out. That'll help. The oral agents, anything that you take by mouth, unless it's an FDA-approved DMSA, has not been demonstrated to reduce cadmium, lead, or other toxic metals. I see them out there. I know they're out there. They claim to have detoxifying power. They have not been proven to achieve that objective. Some folks advocate the use of charcoal. Charcoal can block absorption at the time that you consume foods that contain heavy metals, but they're not going to pull out the stuff that's buried in you and has been there for years. Furthermore, charcoal will block absorption of other essential nutrients, So not a highly recommended path. Better to do things to prevent the risk of cancer than it is to wait and hope you can catch it in the aftermath. Self-breast exam, logical, universally safe. Mammograms, depends on you, your philosophy, your size, your shape, and your personal risk profile. Have you had cancer before? Are you cancer prone? What things can be done to help make that less likely? Well, there are things that have been shown to support mitochondrial health. That seems to be the place where cancer originates. When you do things to support the mitochondria, it's likely to expect that the body will be more cancer resilient. Mitochondrial support includes NAD, nicotinamide adenine dinucleotide, not absorbable as an oral supplement, so don't waste your money. There are injectable forms that can be utilized. If you're under the age of 40, you don't need it unless there's something medically wrong that requires your support for it, because your body makes plenty of it, so don't waste your money. Sirolimus, potentially. Metal reduction, absolutely. Nothing bad about it. Mammograms, they're not bad. And if you choose to get one, it's not the wrong decision. But it should always be your choice. You should always have the opportunity to have a reflective conversation. And you should never be threatened to be discharged from a doctor's practice because you're not going to do what they suggest or advise. Our job is to educate, advise, listen, and be empathic. Our job is not to twist arms and compel pathways or to give you the evil grimace because you're not doing the thing that we think you should. The world of breast cancer, it's horrible that it's so pandemic. It galls me that we're not doing more to look for the origins and modify the risk factors. It's a toxic world. There are things that could be done. We just don't have the real focus on the prevention. It's sad but true. There's not a lot of financial interest in keeping people healthy. I mean, think about it. It's not like it's an evil conspiracy where the government and medicine and the mammogram suites where they want you to be sick. They just don't get paid unless you get sick. There's a perverse kind of an incentive out there. Where's the incentive for you to not get breast cancer? Who gets paid when you lower your cancer risk? Who gets paid when you don't get sick? Really? Like nobody. You just gain the benefit. So there will never be as much zeal, as much marketing, as much promotion behind maintaining your health as there is behind intervening when you're diseased. It overwhelms me in the mornings. I go to the gym and they have the TV screens up. My goodness, a drug a minute, every screen. And the drugs are all, many of them, immunosuppressants causing cancer risk. What I don't see is what you guys are hearing now on this podcast. So fortunately, we do have podcasts. And we have voices like mine and some of my colleagues that are trying to thoughtfully educate you about options that you have, different paths to move forward. The idea of modifying how we age, the idea of taking control of our health and the healthcare decisions and not being forced down a path without reflective thought and being given options. That's what I want, freedom of choice. So ladies, whatever you choose, you now have at least my perspective on how to reflect and how to engage your doctor in the conversation. Well, good luck out there. Stay well and keep tuned into this podcast. I'll do my best to try to keep you on the cutting edge. Talk to you next time.